So as a fellowship-trained orthopedic surgeon in joint replacement surgery, I specialize in replacing hip and knees. The knee is made up of 3 different bones. It's made up of the femur, which is the larger bone above the knee, the tibia, which is the larger bone below the knee, and the small kneecap bone, the patella. And what knee replacement surgery is when the cartilage starts to wear out, that smooth tissue that allows our knees to naturally glide, when it starts to form these potholes in the cartilage, we replace it with metal and plastic. And we replace all 3 of the articulating surfaces, the femur, the tibia, and the patella. But not everyone needs a knee replacement starting off. There are different levels of treatment. The first stage of treatment is non-operative, starting with activity modifications, meaning if it hurts, don't do it, or try something else. Low impact exercises such as swimming is excellent for people with arthritis. And also non-steroidal anti-inflammatory medications such as over-the-counter Aleve or Motrin can be very beneficial. Once the first step in treatment no longer helps, we start thinking more into the second stages of treatment, such as steroid injections or viscosupplementation, which is basically putting oil into the engine. We're lubing up the joint with an artificial lubricant. These may or may not help. It's sometimes patient-specific whether or not it helps or not, but it's worth trying after the first level of treatment no longer helps. Once these non-operative modalities no longer help, the next step in treatment is the operative treatment, such as surgery, specifically knee replacement surgery. And as I said before, we replace all 3 bones, all 3 articulating surfaces of the knee joint. So in knee replacement surgery, we specialize in patients who have primary arthritis, such as osteoarthritis, rheumatoid arthritis, or post-traumatic arthritis. People who have complex issues, such who have had previous traumas or previous surgeries on that joint and need replacements. Those are called complex primaries. And patients who need revisions, meaning patients who have had hip and knee replacement before that need a subsequent surgery on that joint. In this patient here, this patient had a previous trauma resulted in a malunion of the distal femur, and using newer technologies with navigation and everything else, we were able to replace this patient's knee. They had post-traumatic arthritis. And this patient is doing very well, and you can see here we replaced the femur, this bone here, we replaced the tibia, which is this bone here below the knee, and we replaced the kneecap, the surface underneath the patella, which is this little surface right in here. The recovery time for total knee arthroplasty varies based on the patient. I usually tell the patients, give yourself a full 9 to 12 months before you realize full benefit of a knee replacement. Typically, the patients who do best following a knee replacement surgery are patients who have really stuck it out and really have exhausted non-operative modalities. They're the ones that benefit the most from a knee replacement surgery.